Now, since President Cyril Ramaphosa's declaration of a national state of disaster due to the COVID-19 pandemic, various sectors of society have voiced their concern on the impact that this is having on the country. The past couple of days have also seen various business groupings calling on government to accelerate its plan to reopen the economy following a strict nationwide lockdown. And the alcohol and cigarette industries have been at the forefront of such calls amid claims that the ban on the sale of these items have crippled producers and retailers alike. So various political parties have also weighed in with various suggestions on how government could better deal with this pandemic. And of course, the economic freedom fighters are voicing their views as well. The head of political education at the Economic Freedom Fighters, Dr. Mbuyiseni Ndlozi, joins us now on the line. Thanks for your time this morning. Welcome to Morning Live, Dr. Ndlozi.
Thank you, and good morning to all South African viewers and across the continent.
Dr. Ndlozi, let's just start with the EFF's assessment of our nationwide lockdown, which is now into day 43. What have you observed, and what is your assessment of what government has done, and what would you say are some of the good and some of the bad things that government may have done?
Well, it was indeed a great and welcome response when the president put a nationwide lockdown about 5 weeks ago, when the record cases at the time were only about 900. I think the entire epidemiological community, as well as across the world, all of us thought this was a great response. You respond early, so that you are able to exercise the necessary control and advantage over the viral spread of COVID-19. And COVID-19 has a viral, spread capacity that has never been seen before. If you check a study that was published recently on emerging infectious disease, it puts its R0 median of 5.7. And this is, double an earlier rate of 2.2 to 2.7 that the WHO has been believing. And this is a study that, is closely looking at the data that came from Wuhan. So you're talking about each person being able to transmit to 5 to 6 people at a time. This is very high. So when we put the nation under the lockdown at first, that was a welcome improvement, one in a country in which the public healthcare system was in a deep crisis, but also where diseases like HIV, like tuberculosis, and some of the population lacks food is very high. So it's clear that something like COVID-19 was going to become seriously problematic with our kind of unique situation. So that was welcome. But then the president relaxed the lockdown only when the cases were on the rise, only when particularly the epidemiological evidence from community infections in those black areas was coming out. And when it was on the rise, by the time he was uplifting or relaxing the lockdown, an average case a week was above 250 cases per day. So it didn't make sense at all. We're only beginning to see the impact of the lockdown, and we're supposed to sustain it. We're the only country in the world, Sakina, that uplifted the lockdown only when the cases were on the rise, which undermines the entire objective of the lockdown in the first place. And the reasons for the lockdown are that people don't have income anymore. And the question is, if you are opening the economy, which economy will you be opening? Because that is not an economy as the same as the economy before COVID-19 was there. People are going to be going out there and they will be meeting this COVID-19. So you are undermining the lockdown. Had you just sustained it for another 2 months or 3 months even, you could have found a much more, you could have reduced the rate of infection to even more than less than 1, or what they call R0 to be less than 1. So it's really shocking, and it's something that we have condemned, because we believe that as things stand now, you're going to have a serious exorbitant rise And majority of the people that will be affected are those without access to adequate health care, which are mainly black people.
How do you suggest, as the EFF, Dr. Ndlozi, that a government deals with the fact that people are at the moment concerned about dying from hunger, as they would express it, rather than from COVID-19, because the safety nets that were supposed to kick in and cushion the blow for especially the poorest of the poor seemingly has not been as effective as it can and should have been. So how do you suggest government juggles then this particular matter against the reopening of the economy?
Well, the first option is precisely not to put people, which death do you prefer? You can't say, do you want to be killed by hunger or do you want to be killed by COVID-19? These are false choices. There's a false conversation we are all having. So we don't have any other option but for the government to get its act right in relation to the unemployment insurance fund. But the most important, the one that everybody is ignoring, is that, Sakina, the financial sector never came to the party. The financial sector was not forced to give everybody a payment holiday. People have been forced over and over again across the country, even when the financial sector knew that people are not at work. It still continued to take insurance, it still continued to take loans, payments, it still continued to take medical aid. All those payments never stopped. People were not, so all the banks and the insurance companies were not forced to impose payment holidays for people for at least 3 months, as we see in other countries. That would have meant the little money that they made, the little salaries that they got, would have had some relief to go into the essential things that they need to stay at home. And the other thing is the basic income grants are not being given to people who are out of work. The condition for basic income grant at the moment is that you must be unemployed. But everybody is at home. So you must assume that everybody has been forced out of work except the health workers, security guards, and people generally in essential services. You are supposed to be giving everybody money in order for them to survive the lockdown. So those are some of the things that we've got to get right. The options are not, do you want to be killed by COVID-19 or do you want to be killed by hunger? Let us put people in a social safety net, sustain a hard lockdown as it was the case in Wuhan. Only then will we be successful. Otherwise, you're going to have too many cases of infection than your health system can handle. Even group immunity won't be the option because there will be too many people for you to treat. In the health, for you to treat in relation to your health system capabilities. And then the final point is that there's nothing more ridiculous than the fact that than the demand of the alcohol industry to uplift the ban on alcohol sales. That's the most ridiculous because it's a proven fact that alcohol has the most devastating social impact, and it will be much more difficult to control society in a crisis like this with alcohol going around. And we must further dispel that there is illegal alcohol being sold. If there is illegal alcohol being sold, the police must begin to tell us what are those brands. And I can tell you now without a shadow of doubt that an illegal sale of alcohol requires SAB and the rest of all those brands to continue production. And if they are continuing production, it is them that are selling illegal alcohol. It's not people out there. And they must be busted. So if the police are monitoring all those factories, including cigarettes, there's no person in the illicit cigarette industry with the capacity to substitute Stevie Sands and all those brands. If there is illicit trade of cigarettes, and here I don't mean people avoiding taxes, I mean the existing brands being sold illegally, then it means all those companies of big white monopoly capitalist-owned companies are continuing production. And for you to stop them, you've got to go to the heart of the beast and stop their production from British American tobacco and the rest of them. There's nobody producing cigarettes outside those brands. There's nobody producing alcohol outside the big brands. If there's illegal sale of all those things, then it means the big companies have not stopped production.
So just coming back to this false conversation that you say we are having, Dr. Ndlozi, with regard to people suffering at this point. Your own party, you've been distributing food parcels. You've been paying, I don't know what to call it, stipends to artists, for example, as the EFF. And I think by so doing, you are acknowledging that people are actually suffering during this lockdown. So in the absence of those safety mechanisms, those safety nets kicking in effectively and timeously, how do you then say to people they should not be going out and trying to reopen the economy to establish and make a livelihood for themselves?
Well, Sakina, it is. Unfortunately, we are forced to think this way because it's as if the only option of an economy that humanity ever knows is the free market economy. If you open your saloon, you're going to get the disease. If we all fill up the stations, whether the bus stations or whether it's train stations, if we go into those spaces in huge crowds, we are going to contract the disease. The disease, the study I'm talking about, which was published by the emerging infectious diseases, actually says that it found that the doubling time, meaning how long it takes for a number of COVID-19 cases, hospitalization, and deaths to double, is 2 to 3 days. These are new discoveries based on studying the data coming from Wuhan. You're talking about something that the world has ever seen, something actually worse than the Spanish flu of 1918 to 1920. We have to get the government safety net right. What is waiting for us out there is not the normal economy. Stop spreading that. There's no normal economy. Out there is an infectious disease that is waiting to literally take our breath away, collapse our lungs, and will die. So it's not whether you die this way or it's not two options of death. It is whether we die or we get the safety social network that we have all agreed about through the government processes. So that's where the pressure must go. That's where the conversation must go. That's where every day the news report and the news accountability should start. Minister of Labor, are you getting this right? Minister of Finance, why are we not making sure that the financial sector is imposed upon by society as a whole to give payment holidays to everybody for at least 3 months? Interest-free payment holidays. People will have enough money in their hands to continue staying at home. Otherwise, we're having a wrong conversation altogether.
Final question, Dr. Ndlozi, before we go to news headlines. Do you believe that government is being pressured into making the decision to have moved from level 5 to level 4, and to reopen the economy?
The move to level 4 was a miscalculation that this government will regret and the rest of us will regret for the longest of time. It is the basic unleashing of mass murder of our people, because when the viral spread reaches unprecedented levels, it is actually the poor who are going to suffer in the most. And in our country, those poor are in the majority black people. So we are looking at the looming apocalypse, literally unleashed by a government that does not want to get, number one, the safety social networks right, that does not want to impose upon the stubborn financial sector to forget profiteering and impose on it payment holidays for at least interest-free payment holidays for at least 3 months, including the Reserve Bank coming into place. Across the world, central banks are putting money into the economy. Only our central bank, only our Reserve Bank is still trying to play like we're in a normal economy. We're not in a normal economy. We're in a crisis. The financial sector must be forced to come into the party. Otherwise, it's death either way.
Well, thank you so much for your time this morning. Economic Freedom Fighters Head of Political Education, Dr. Mbuyiseni Ndlozi, giving us the EFF's perspective regarding South Africa's nationwide lockdown.